Well, hello and welcome to the Thursday, or as we like to call it around here, Friday Eve edition of the Todd Veinotte Show. I'm Dan Alstrand. Glad you're able to spend a few minutes with us today as we roll forward in your work week. Another one of those sunny days today. It was a lovely drive in, but my goodness, I had to work extra hard to get the frost off the windshield this morning. It was frosty out there. But no wind. If you were listening to our weather forecast yesterday, you heard from Alistair Alders that the wind that we've been seeing pretty much for the whole month of November has subsided, at least for a couple of days. And I know that's going to afford you the opportunity maybe this weekend to go about the annual process of putting up the Christmas decorations, right? It's that time of the year. Some say the most wonderful time of the year. Others, maybe not so much. But I can attest, and I know many of you that are driving out there today and listening to us can remember the bitterly cold fingertips trying to hang those lights and all of that other stuff that gets put up on the balconies and on the houses and on the eaves. Looks like today might be a good day to maybe tackle that. Maybe the beginning of tomorrow. Friday afternoon, though, it looks like the forecast is going to do a bit of a change. We're going to see some showers roll in. They're going to continue on through the weekend, well, through Saturday anyway. Sunday might be another opportunity for your to get festive, I will say. It looks like it's going to be a mix of sun and cloud, but the winds are going to pick up a little bit. So I think we're getting close to the Black Friday, right? That's next week. And is Black Friday even a thing anymore? If you've been watching your television, you've seen the Black Friday sales have already been happening for weeks now. I don't think that Black Friday is much of a thing, but it's still a date on the calendar. And I know that many of you kind of start your progress towards full Christmas by Black Friday. The rule of my house is we're not doing the decorations. I've got lights up, but we are not doing the decorations until after the calendar turns into December. Mostly because I'm lazy. But that's when things are going to happen in our house. But the weather looks like it's going to cooperate if you want to get a head start on that, at least for the next day, maybe in a bit. And then Sunday looks like it'll be a good day for that as well. You'll have to excuse me if I'm a little bleary-eyed today. Went home after the show and started to watch the first of what will be a series of budget deliberations at City Hall last night. I think that meeting went into 6 hours. And there was an awful lot of discussion, presentations from staff, from the CAO, and some comments on the budget from the CFO, the Chief Financial Officer, as our council stares down the gauntlet, as I said yesterday, of a 10.5% increase in the budget. Now, we know that's not going to be the final number. And I've said many times, I'm not an accountant, but I was following along yesterday, and when you factor in what they are averaging now as a 4% increase in assessments. Now, that's an average. We won't get those assessments till later this year, but that's the working number that they've been working with. That will lower the amount of money that will be needed to be generated from property tax, right? That part I understand. And they're averaging that at about a 4% increase or 4% more of the budget. So I think we're probably going to settle in a number somewhere about 7% maybe. But we won't know that until the budget has been fully deliberated and all of the adjustments made. The mayor of Halifax yesterday, using the opportunity of the first day of the budget to issue a statement, and I'll read part of it here for you. It reads like this: today, which was yesterday, Halifax Regional Council's Budget Committee began developing the 2026-27 budget. Affordability is the top concern for everyone right now, said Andy Fillmore. Our job at City Hall must be to reduce the property tax burden on residents as much as possible. In April of 2025, Mayor Fillmore presented a motion directing municipal staff to develop, and this word has been kicked around a lot, right? Bare bones budget, with only increases coming from unavoidable expenses like inflation, contractual obligations, and mandatory provincial contributions. The bare bones budget includes an increase of $88.9 million, or an average tax bill increase of about 10.5%. Now, yesterday, following along with the budget deliberations, I'd raised concerns about the number that they use for the average property value, right? They say, well, this 10.5% increase will affect the average property value in HRM at, what was it, $270. Well, that number is around $350,000 as an average, and I know most of you that are listening to us today probably have an assessment value that is higher than $350,000, but that's the number that they use to kick around this $270 figure. The mayor's statement goes on to say this would come on top of a potential 2.4% rate increase from Nova Scotia Power. There's two of those. And a 36% increase from Halifax Water. The mayor says these additional costs are simply too high for residents. Every decision we make must reflect the realities our residents face. He goes on to say at today's budget committee meeting, Mayor Fillmore presented a motion that tasked municipal staff to find further savings. That includes a 10% cut to program grants, reducing the climate action tax by 1/3, and implementing a staffing freeze. So that's all new as of yesterday. I'll say it again. 10% cut to program grants, reducing the climate action tax by 1/3, and implementing a staff freeze. The motion was adopted, and the Budget Committee will make further decisions on these items in the coming months. Nothing's off the table, concludes Mayor Fillmore, but through constructive conversations around the council table and a focus on delivering our core services, I believe we can make decisions that are both responsible and compassionate. That was the statement from the mayor of Halifax. We've had a discussion with the mayor of Halifax right here in the studio about some of this stuff, and with many of the councillors that join us for Councillors on the Hot Seat. Know many of you have raised the climate tax many times on this program. That helps to fund Halifax. I think it's 3% is the total of the tax revenue that is generated in the municipality goes to the climate program. The mayor is proposing that be cut by 1/3. So there's a savings there. A 10% reduction in program grants. I know many of you out there that are working in the not-for-profit sector probably didn't want to hear that. And, of course, the staffing freeze. And many of you have raised that specter as a way to save money with some of the salaries that are paid to people working within the municipality. They didn't say they were going to have any, or the statement didn't say that they were going to have any staff reductions. They were just going to put a freeze on staffing, which seems to be the corporate way of doing things these days. When budgets are tight, they just don't replace people that leave. And I know there are some that agree with that. Some of you out there don't. But that was the latest from the mayor. A couple of other things very quickly before we take our first break here on the program that I noticed yesterday and I thought would be of interest to you as I was watching the budget deliberations. I think for the first time, the acting CEO, Brad Anguish, yesterday said for the first time that the budget documents are showing a projection of what's going to happen in the next 4 or 5 years. Normally we get this 1 year, this one look and some 1 year picture and staff and a council make a decision, and they sometimes will move expenses down the road, kick the can down the road, as they say. And that's actually coming back to bite us this year a little bit with some of the decisions that have been made in the past. All that being said, this year 10.5% is the starting point. Next year they're projecting the starting point, and again, it's a projection, right? So much can change between now and this time next year. But the projection is that we are going to start or be looking at a 8.8% increase in municipal tax. So that's if we do 10.5 this year, it'll be 8.8 next year. And then longer range projections, and again, I put a caveat on it, they're projections, but the numbers are kind of scary. They're looking at a 12% increase in the following year, followed by another 12% increase in year 4. Now, it's simple math, and I know the accountants and the mathematicians out there are going to say that I'm wrong because it compounds, right? And I get that, and I understand it. But just based on those numbers, that's like 40% or more increase in property tax in the next 4 years. That's a lot. I wish City Council the very best as they deliberate this, and glad to hear that maybe some of your concerns, some of our concerns that we've raised over the last month or month and a half when we've been talking about the budget have rung in, at least into the ears of the mayor who put the resolution forth last night. It's something that we've been talking about here on this program for a long time, about not just this 10.5%, and people are sending me notes and saying, Dan, it's $270. Like it hurts, but it's not a lot, and I get it. But $270 for some of us out there that are listening today that's a lot of money, and it's probably more, right? But the mayor recognizing the 2.4% increase in your power rates that's coming next year, and then the year after that, and then the 36% increase in your water bill. Times are tough, folks. And we'll keep an eye on the budget discussions as we roll forth here on the program. Just a very quick programming note. Tomorrow is Friday. It's the Fabulous Friday edition. And to make it even more fabulous, don't forget, we're going to have a 1 hour long conversation with the Premier of Nova Scotia, Tim Houston, who today is in Boston. He's a jet setter. He's running up the frequent flyer points, I'll say. And he's going to travel back, we hope, and we'll be here to join us at 11 o'clock to take some calls and to answer some questions. I will caution you that it is a very popular segment, as you well know, and some of you have already sent me email questions, and we'll try to get to as many as we can, but you can appreciate that there's only a limited amount of time, and an hour on this talk show is not a very long time at all. So get your calls in early, and we'll try to get to as many as we can. We'll try to facilitate as many questions to the Premier as we can, but we're very pleased that he's going to spend an hour with us, and that's going to happen at 11 o'clock tomorrow right here on the Todd Veinotte Show. Getting ready to take our first break here. It is the Thursday edition. We talked about this yesterday, and then we had a bit of a scheduling snafu, which is normal. So we pushed it off today, but I think it's important, and that's why we're going to talk about it. A conversation with the Neighbourhood Pharmacy Association of Canada. A new poll showing that many of you out there want to see more services provided at pharmacies. Right? We've talked about this. The Premier's talked about it the last time we were in here, how this is part of an effort to free up some space in the clinics and in the ER rooms, and having physicians who are already trained in most of this stuff be able to do some more routine things, right? We know we can go to the pharmacy for instance, we can if you get bitten by a tick, you can go there and get that looked at. There's a number of different things that pharmacists are able to do now, and Canadians are asking for that service to be expanded. We're going to dig into this when we have a conversation with the CEO of the Neighbourhood Pharmacy Association of Canada. Sandra Hanna will be your guest when we return. You're listening to the Todd Veinotte Show. I'm Dan Alstrand. Happy Thursday. We're back in minutes. Thanks. All right, welcome back. Friday Eve edition of the Todd Veinotte Show. Glad you're able to spend some time with us as millions of Canadians continue to struggle with barriers to health care. This release from the Neighbourhood Pharmacy Association of Canada. Growing number of patients want to see more health services provided by their local pharmacies, according to research. A survey carried out by the Neighbourhood Pharmacies and Abacus data found more than 75%. 3 out of every 4 Canadians support an expanded pharmacy scope of services to improve timely access to care, reduce emergency room overcrowding, and better serve rural and remote communities. Very pleased to welcome to the show CEO of the Neighbourhood Pharmacy Association of Canada and a pharmacist herself, Sandra Hanna. Sandra, how are you?
Hello, thanks for having me. I'm doing great. How are you doing today?
I am doing well. This shouldn't come as much as of a surprise, being that we've seen an expansion of services, particularly here in Nova Scotia, of some of the things that we can get taken care of at the pharmacy, and for the most part, people are pretty happy that they don't have to try and wade through the rest of the medical system, get an appointment with that family doctor, or if they don't have one, go to a walk-in or go to the emergency to get some, and I put quotes around this, minor things taken care of.
Yeah. So as you said, I think we've had challenges with our healthcare system for some time, and Nova Scotia has done some amazing things to expand the role of pharmacists and really enable them to support in helping people access care. And we really wanted to look at how that's going and really understand how people are feeling about that expansion, what their experience has been, what they have liked, why they have chosen to go to pharmacies. And the data is pretty clear. As you said, 75% are, wanting to see more services offered at pharmacies. There's really good awareness of the additional services beyond dispensing services the pharmacies can provide now. 9 in 10 Canadians are aware of those services. Pharmacies are the most accessible healthcare touchpoint people have with the system. So 95% of Canadians live within 5 kilometers of a pharmacy. People typically see their pharmacist or their pharmacy team 10 times more than any other touchpoint with the healthcare system. So it makes sense to have pharmacies offer more and more services. As you said, wait time, staffing shortages, emergency room overcrowding, those are all challenges people have identified, barriers to them accessing care. And so, Nova Scotia has done some amazing things, as I said, and people have been accessing these services, and we asked how satisfied they were, and 85+% are really reporting high satisfaction with the services. So we want to continue to deliver those services, continue to meet the needs of Canadians and Nova Scotians, and we want to respond to what we're hearing from people.
Sandra, what about the pharmacists themselves? Going down to my neighborhood pharmacy on the occasions when I do, it's a busy place. They're usually quite busy doing all of the things that we have grown accustomed to pharmacists doing. Dispensing obviously being a big portion of that. Is this going to create extra workload on already busy pharmacists?
I mean, it is. You're right. I think pharmacies are a busy place, and we're working really hard with operators and pharmacy associations and regulators to all kind of do our part to ensure that we're best supporting those pharmacy teams with whatever tools we can, because ultimately we're there to serve our communities, and we're there to work alongside other healthcare providers and other parts of the health system so that we can meet the needs of those communities. And people are seeing that pharmacists and pharmacies can do more, and we want to be able to deliver more. And so, in collaboration with other associations, regulators, other healthcare providers, we all need to do what we can to chip in, and it's all hands on deck to make sure that we're getting people the care they need,
Sandra,
where they need it.
How about training? Pharmacists obviously undergo a lot of school. They have to go to school for a long time. With these additional services or these services that they're providing now, does that require them to take more training, or they already receive this as part of their education?
Pharmacists receive significant amount of education. They're trained for 6 years on these conditions and how to treat them and how to ensure that people are getting the right medications for the conditions they have. They're trained and graduating. New pharmacists are graduating with the ability to do all of these services. What we need to do is unlock their ability to be able to deliver these services, ensure that they're funded appropriately to deliver those services, and ensure that we give them the space and the supports they need in order to deliver those services. So in terms of training, no barriers at all. They're very well trained and very well able to deliver a lot of these services.
Sandra, we know I'm familiar with some of the services, particularly here in Nova Scotia, that pharmacists have now been able to provide to their customers and to their neighbors. That being said, with Canadians looking for an expansion, are there specific areas that this would work where pharmacists could take on a bigger role?
Well, I think we've started to see pharmacies play a much bigger role in, obviously, vaccination. They're really playing a leading role there, playing a larger role in common or minor, quote unquote, as you said, quote unquote, minor ailments,
right.
Common ailments. I think we're going to start seeing pharmacies play a much bigger role in chronic disease management more broadly. I think with the strains on primary care and on hospitals, things that can be managed in the community and can be managed safely in the community, pharmacists are very well positioned to be able to do more of that and to play a greater role in those types of services. So I think chronic disease management, really from diagnosis all the way through to, initiating therapy and managing dosing and ensuring that people are responding to their medication therapies. These are all things that pharmacists are trained to be able to do in school. And so opportunities certainly to expand the role they play in these areas.
Sandra, in your day-to-day practice as a pharmacist, what role can a pharmacist can a pharmacist handle that most people don't know about? When you say, "Hey, we can do that," and they're most surprised. What service is that?
Interestingly, all of those services. So I think, as I mentioned, I think if you have somebody who comes in with a chronic condition, pharmacists are really well trained to be able to identify that you have that chronic disease or condition, are able to start you on the first medication. We don't have the authority to do that everywhere, but we are fully trained to do that. In terms of what they can and are authorized to do, but maybe people are less aware about, a lot of the common ailments, testing to monitor conditions or screening, dose management, renewals of prescriptions, all of those things pharmacists are able to do. So if you have any concerns or questions about your medication therapy, there's a good chance your pharmacist can help you at the pharmacy with those concerns or questions.
I always learn something when I go to my pharmacy, even if it's just to pick up a prescription, have a brief conversation with the pharmacist and the pharmacist doing their job to make sure that everything's okay on my end of things, and always brings that education component to me.
Well, I'm super happy to hear that, and I hope you go into your pharmacy and learn something new, next time you have a challenge or question.
Sandra, I appreciate your time.
Thanks so much for having me. Take care.
That is Sandra Hanna, the CEO of the Neighbourhood Pharmacy Association of Canada. She's also an active pharmacist. They can do all kinds of things, folks. And the PANS website, the Pharmacy Association of Nova Scotia, has a really comprehensive list of what pharmacies can do what. There are different services provided at different pharmacies, but if you're curious and you're thinking, hey, maybe I don't have to go to my doctor, I have to go wait in the ER for all those hours, I encourage you to go and check that out and take advantage of the services that you provide. I love my neighborhood pharmacist is part of our community, right? So they're there to look after it. We're going to take a break here. We're going to get an update on what's going on in the news. And when we come back, we're going to have a brief conversation with the Nova Scotia Health Coalition. And we're going to focus on public universal health care. You're listening to the Todd Veinotte Show. I'm Dan Alstrand. We're back in minutes. Welcome back to the Todd Veinotte Show. I'm Dan Alstrand. You may have missed this as it has been a busy week, and a statement was delivered by the Department of Health and Wellness back on the 17th, and it reads like this. Every year, thousands of Nova Scotians book free appointments through the Provincial Mental Health and Addictions Intake Line for support in their mental health and to help Nova Scotians get more timely care. A new and innovative program was launched in July through a partnership with private clinicians. More mood and anxiety appointments can be offered through the intake line. More options mean shorter wait times and more timely care for Nova Scotians. This is just one example of how Nova Scotians have more access to universal addiction and mental health care. Other programs offered as part of the universal access include supports delivered through our partners at the IWK and Nova Scotia Health, programs offered at the local community organizations, free counseling online at Access Wellness, walk-in support for substance use at recovery support centers, walk-in help for youth at Anchors Youth Spaces, and much more. That statement attributed to the Department of Health and Wellness on November the 17th, this week. The Nova Scotia Health Coalition, reading that statement, has raised a series of concerns about it, and we're very pleased to welcome to the show to tell us a little bit about it the Provincial Coordinator for the Nova Scotia Health Coalition, and that's Jennifer Benoit. Jennifer, how are you?
I'm well, thank you. Thank you for having me.
I guess the broad question to start things off, Jennifer, is why are there concerns about what was said in that statement by Nova Scotia Health?
Well, the concerning parts of this is the normalization and calling innovation on privatization of our universal health care. Although Nova Scotians aren't paying out of pocket for the service, it creates a two-tier system. And that is actually eroding our universal healthcare system, not investing in it.
That gets talked about a lot, and not necessarily just on this file. I think we even had a conversation with the Premier about that, if this is creating a two-tier system. And the government seems to be of the opinion that because Canadians or Nova Scotians aren't actually out of pocket, then that isn't the definition of a two-tier system. You disagree?
Absolutely, we disagree. Money spent in privatization of our healthcare is not an investment into hiring, training, and retaining public sector psychologists, social workers, counselors. Private delivery almost always costs more to deliver, and these funds could instead be building sustainable public services, but instead they're supporting a short-term outsourcing that does not expand any permanent public infrastructure. It will no longer, it will lead to longer wait times for those who are not privileged enough to be where these private practices are, which is normally in urban areas, because we only still have so many clinicians in the system, and if we're taking them and privatizing them, the public who are in those areas are left with whoever is left, leading to longer wait times for those people.
Makes a lot of sense that that somebody that's in that field and is in private business is where the people are, and I would imagine would have a lot of supports in the built-up urban areas, but if you get out into the far reaches of HRM, that service becomes less and less, correct?
That's right. If you take somebody who lives in, it's just an example, in Canso or Neils Harbor in Cape Breton, they're not going to have the same kind of accesses to these services as somebody outside of HRM or inside HRM, for example, where a lot of private practices are, because they can have a multitude of practitioners under one umbrella. There's more resources.
Also interesting to me that this is being sold as a way to expand universal access to these kind of services. But
yeah,
is it really universal? Because
exactly the
right?
opposite.
Yeah.
If they are pointing it as a free point of access service, contracting out care for privatized providers creates the parallel track of services. Over time, those clinicians may be drawn out of the public system, which they are already, and taking a better pay in private contracts, reducing the capacity, and it's leading to a two-tier healthcare system with further privatization coming. It's just a spiral effect where we're going to end up with a two-tiered system, whether we like it or not. The government will say nobody's paying out of pocket. The fact that we're not paying out of pocket still means there's profitization of people's health. and it is not publicly delivered, publicly funded, universal if somebody is profiting off of our health.
Gives the government sorry, Jennifer, it gives the government an opportunity to say, like, look what we've done, right? We're doing a great job giving more access, but really it's kind of a shell game.
Yeah, and it's not innovative. You know, they're in the statement, they called this an innovative improvement. Well, it's not innovative. It's a Band-Aid, fill in the gaps, a measure to try and fix chronically underfunding, understaffing, and long wait times in the public service. Privatization is not the solution. It's rather causing more problems that we will see longer down term in the future, and we're seeing it now already. There's less pressure for the government to fix the public system if they continue to invest into the privatization of our healthcare services.
What's a better... Sorry, Jennifer, we're just about out of time. What's a better approach? What would the coalition advocate for here?
We would definitely be advocating for more investment into our public system, pay these clinicians what they're worth to keep them retained in the public system. We need to make sure we understand the capacity and the chronic need for these services and work with them and innovate with them. This didn't just happen overnight that we're in this chronic situation with our healthcare. This has happened over time, and over time, governments have either closed a blind eye to it, or, and that's not just the current government, or there's been cuts. We knew that this was going to happen. Even around the mental health and addictions piece, when COVID happened, there was many who cried out to say, this is going to affect people's mental health and addiction. We need to take a, hard look at this immediately. Nothing was done, or very little. And now here we are. We're going with a stop the gaps emergency system instead of true investment into our universal health care system.
Jennifer, some out there suggest that the whole country, in fact, probably all of North America, if not the world, are all competing for the same doctors for these services to provide, and would suggest that outside the box thinking, like we're seeing here with the accessing the private system is the only way that we can do this. What's your response to that?
My response, or our response to this, would be absolutely not. If we attract them by telling them we're going to support you, we're going to invest in you, in our public system, we're going to make sure you have the supports you need to not feel overburdened, to not have burnout, to have a work-life balance. If we offer those types of services to our clinicians, then they're going to be more attracted to stay in a public system rather than leaving it. And that is the solution we need to show around the world, that we are innovative because we care, and we're going to invest in them to make them truly part of our universal healthcare system.
Jennifer, we're out of time. I appreciate yours.
Thank you so much. Have a great day.
That is Jennifer Benoit, Provincial Coordinator of the Nova Scotia Health Coalition. We're going to take a break here, and on the other side of it, the show will continue. The 19th annual Be a Santa to a Senior program is right around the corner. We're going to dig in a little bit deeper into it with the Director of Service and Engagement at Home Instead. When we return, you're listening to The Todd Veinotte Show. I'm Dan Olstrand. We're back in minutes. Well, when we think of the Christmas season, right, we think of all of the fun and frivolity of the festive time of year, right? We get together. There's work parties. There's family gatherings. Maybe you and your friends do some sort of an event. Maybe there's a gift exchange. There's 100 different ways that we get together to celebrate the Christmas season here in our part of the world. But Christmas can be a pretty lonely time for some if they don't have any family, or they're maybe financially disadvantaged, or maybe they're shut in, and it's watching all of this stuff unfolding around you can create a rather lonely and depressing time of the year. Now, there's an organization out there that's trying to brighten up the days of particularly seniors who are in that situation, who are lonely or at home alone, or in an area where they don't have family or so on and so forth, and to have created a program. This is the 19th year for it, so it's been around a while. It's called Be a Santa to a Senior, and we're very pleased to welcome to the show to tell us a little bit more about it the Director of Service and Engagement at Home Instead, and that's Brittany Meaghan. Brittany, how are you?
Hi, I'm doing great, thanks. How are you?
I am well. Tell me a little bit about Be a Santa to a Senior. What was how did this come about? Was it to try and bring more cheer to those maybe that didn't have as much fun as the rest of us during the holiday season?
Yes, exactly. So it's really important to us to give back and give a special gift to those in our community, and especially aging adults who might be overlooked and just need something through this season that, like you said, can be very isolating, and for those who might not have family around or through the year just don't have the financial needs for just basic necessities. So that's where Be a Santa to a Senior was created, and Home Instead has been doing this now, like you said, for 19 years.
How do you identify the seniors that would be a part of this program?
Yeah, so we work with individuals who have seniors in their care and long-term care that help me identify those who might not have family around during the holidays, as well as social workers in the hospital who nominate seniors who might be in the hospital over the holidays, as well as some senior center. And then there's also community nominations as well. So we get nominations kind of from a ton of different places just to make sure that these seniors are identified and don't go without, especially during this time of year.
And once those seniors are identified, Brittany, what happens? Is there do you just show up and hand them a present and hopefully put a smile on their face?
So what happens is they send a list to us here at Home Instead. We write the senior's name along with their Christmas wish on a ornament. And what we do is we feature these ornaments at the 4 Berkeley locations. We've been lucky enough to have the support of the Berkeley to host trees at their locations, as well as the Home Instead office. And community members can pop by any of these Christmas trees, pick up a bulb, purchase the present, and then bring it back to the place where they picked it up unwrapped. And then we do have a wrapping party that we wrap all of the gifts, and the seniors that live at the Berkeley locations, they help out by wrapping the gifts too. And a lot of them will also purchase gifts for this initiative. So it's really great to have their support on this as well.
And then I would imagine there's an army of elves that go out to distribute all this stuff, right?
Yes, and we're lucky enough to have the support of Halifax Regional Police, and they help us with the deliveries. And we do a bunch of deliveries with our staff here at Home Instead, and we have volunteers that help us. So it does really take a lot of people to make this special program such a success year after year.
Brittany, obviously this doesn't happen without support of the community. You are solicit donations from corporate or from individuals, or how does that work?
Yes, we have tons of organizations so that instead of maybe doing like a secret Santa for each other, they use this as a way to do their gift giving and make it special in a big team effort. So we have like so many different businesses that help out year after year. So Dexter, Southwest Properties, Halifax Transit. We have so many people that just support this program year after year, and we can be more appreciative of the support that they give. And then so many community members. There's probably so many other organizations that I don't know of that just do this year after year, and it makes such a difference. We've seen hockey teams, soccer teams, schools, just so many different places that contribute to this, and churches, and it just makes such a difference.
If there's a group out there, Brittany, that maybe thinks this is something that they want to take on this year, what's the best way to do that?
The best way is to call Home Instead. So our phone number is 902-429-2273. They can speak with myself or my colleague Rosie, and we can give them all the information of how to get involved. Or if they pop into any of the Berkeley locations, so there's the Berkeley in Bedford, Dartmouth, and then 2 in Halifax, or the Home Instead office on Spring Garden Road, then we can help out. And then there's some people who might not be able to get out to do shopping. We can also do that on their behalf. So if that's something somebody would be interested in, they can also reach out to us for more information on how to make that happen.
Brittany, appreciate you sharing some information with us today. Merry Christmas.
Yeah, thanks so much for having me, and Merry Christmas.
That is Brittany Meaghan from this Be a Santa to a Senior program. Everybody deserves to have a bit of Christmas cheer during the year, do they not? This one of many programs that happen throughout HRM and across the province, and in fact, right across the country as we get into that season of giving. Getting ready to take another break here on the program. We're, of course, going to open up the telephone lines after the news at 11 o'clock. The open hour will take flight. Normal rules apply. You can talk about whatever it is on your mind. I'm curious if you heard or read or watched the mayor yesterday talking about the budget deliberations that got underway, suggesting that city staff come back to council with a barer bones budget. They were already asked once to come back with a bare bone budget, and that included a 10.5% increase in property taxes. Mayor now and council supporting his resolution, asking them to go back and sharpen their pencils again. A couple of programs that were highlighted in the mayor's statement yesterday was a 10% reduction in community grants, program grants. Also included in that was a reduction in the budget for the Halifax budget, the climate tax, that by 1%, and a staffing freeze, which, to be honest with you, was the first time in many conversations that we've had here on the city budget for several weeks now that has been brought forward. 902-405-6000, 1-877-801-8255. That is the number. Also, I mentioned off the top of the show that it might be a good opportunity for you to get out and get the Christmas decorating started today, and because the weather's going to change Friday afternoon and into Saturday for a rainy day, I guess you can call it. Sunday not looking too bad. And I got a number of emails from people saying that it's too early, Dan. What are you talking about? Is there an appropriate date? I know we've talked about this in the past. Remembrance Day being kind of the sort of landmark that people kind of gravitate towards when it comes to putting up their decorations. I wonder if you have is there a traditional time that you do this, or do you even decorate? Because a lot of people don't. Maybe something that you want to talk about as part of the open hour as well. We're going to open up those telephone lines. They're going to open right now, 902-405-6000 or 1-877-801-8255. Your chance to talk about whatever it is that is on your mind, something you heard earlier today, earlier this week, something we didn't talk about. 902-405-6000, 1-877-801-8255. Going to take a break. Blake's going to update us on the news, the open hour on the other side. We're back in minutes.
Facts.
All right, time for the open hour. 902-405-6000 or 1-877-801-8255. As always, normal rules apply. You can talk about whatever it is on your mind, an opinion, a perfect opportunity to share it. A couple of things, of course, that I've received a number of emails from and we've had discussions about in the past is the ongoing situation at City Hall with the municipal budget deliberations getting underway. yesterday. The mayor putting out a statement near the end of those deliberations on a motion that he'd put forth before council that was approved by the budget committee, as they're called. And it says that we need to take a 10% look at 10% cuts to services, program grants rather, to reducing the climate tax by 1/3 and put a freeze on staffing. The mayor saying that with all of the financial pressures that we are about to face, with an increase in our power bill, with an increase in our water bill, and at this point, a double-digit increase in our property taxes, that it's unaffordable for many Haligonians, or for residents of HRM, I should say. And that is why he put the motion forward. I've watched a number of budget debates in my time. They're quite boring, to be quite honest with you. But this one had a different feel to it, maybe. It just feels like that things are pretty tough, and some very tough decisions over the next month or so are going to have to be made. There was some discussion yesterday about some of the big capital projects that are on the agenda, the forum, right? The BRT system, the active transportation. I think that all of these need a close scrutiny, and if council has now directed city staff to go back again and look for savings, I think that that's an indication of what we have to come. I don't think, just based on some of the numbers I saw yesterday, I don't think that, well, it's pretty evident that we're not going to see a 10.5% increase. That's the starting number, and if past budgets are any indication, there will be some reduction in that. And I think once we get an idea of what the provincial property tax assessment is going to be, then that's going to drive the number down, not necessarily some of the big decisions that council has to make. I'm guessing that it's going to be somewhere in the maybe 6.5%, 7.5% range. That's just my guess, and I don't know anything any different than you do, but that's my guess as to where this is going to end up, which is still a significant increase. Very quickly before we go to the phones, the numbers that I saw yesterday as part of some of the budget presentation were eye-opening and quite shocking. And this, I think, and I stand to be corrected on this, but I think Brad Anguish, who's the acting CAO of the municipality, said that for the first time they're actually showing council the projections for years to come, not just this year, for the next 4 years. And I'll tell you, folks, some of those projections are quite scary. Today, 10.5%. Next year, 8.8%. Year after that, 12%. Year after that, 12%. So you can do the math on that. And the next 4 years of budget deliberations likely going to be as somber as these ones are. 902-405-6000, 1-877-801-8255. An email from Sarah says, just curious on this sunny, gorgeous day, how many cyclists you saw going around the city to work? 200, 500? Now I want you to think about how much money was wasted by everyone sitting in their car in traffic. Extra waste is a tax. With the budget deliberations and increase in water and power, these councillors better make the right choice and start cutting bike lanes, or stuff is going to hit the fan. And this from Rob, as far as I can see, Mayor Fillmore is leading the way on making the hard decisions to cut staffing. He didn't say cut staffing, Rob. He said to freeze staffing. So I think there's a distinction there. When you say cut staffing, that means that they're going to start laying people off. And that's not the feel I got from the meeting last night. I think it was if somebody goes or there are vacant positions that are available now, then they just won't be filled. I think there's a distinction there. And Rob goes on to write, services to avoid a catastrophic tax increase, being willing to look at sacred cows like the climate tax is the only responsible thing to do given the circumstances. Inevitably, we'll see a lot of pushback from some councillors who seem to believe that taxpayers have indefinitely deep pockets to fund their pet projects. 902-405-6000, 1-877-801-8255. We begin on the phones with Tim. Tim, how are you?
Morning, Dan. How are you?
Good. It's on your mind.
Good. Well, listen, before we start projecting numbers, I think we should listen to what the results are and hold council accountable, and at the end of the day, then make an informed decision. But that's not why I'm calling.
Sure.
In regards to caregivers, I'm not sure what the provincial government, if anything, are doing to increase the wages, but I can tell you firsthand that there's many professional, caring, compassionate caregivers out there that are certainly underpaid and deserve more, and I'd be interested to hear what Mr. Houston or the health minister is doing to increase the wages for the caregivers.
Are you talking long-term care? Are you talking nurses, or all of them?
The individuals that visit homes, the individuals that improve or enhance people's lives, depend on every day, and in some respects are certainly underpaid. And I think thus far I haven't heard much about it, but I'd be interested to hear what the department or what the government has as a plan to do both.
Well, the Premier's in here tomorrow, Tim, so maybe he'll answer that question.
Well, I'd be happy to continue to listen. I look forward to his response.
All right. Appreciate the call, Tim. 902-405-6000, 1-877-801-8255. I know there was a lot of debate about it not being even worth them, people getting in their car to go to these home support workers. It was costing them more to go and deliver the service than they were being paid. And I know that there was a contract dispute over that a couple of years ago. So it might be something that the Premier will talk about here on the show tomorrow. 902-405-6000, 1-877-801-8255. Let's welcome Donna to the show. Donna, how are you?
I'm fine, thank you. And thank you for taking my call.
Sure.
I just wanted to do a little bit of praise these kids. Skills Canada, I hope I'm getting my facts right. Skills Canada had a competition. It is to do with energy efficiency. And there was 32 teams of Nova Scotia students. They were judged by a panel of experts, and a team of 2 boys from Goresbrook Junior High won the competition, and they came first. And tomorrow, they and their teacher, the only reason I know this, a little bit of praise, the teacher is my nephew, Luke Chalk. Luke and the teacher and the 2 boys are off tomorrow to Newfoundland for another competition for the Nationals. And I just want to wish them all a good, safe trip and all the best. And if these kids win there, I will get permission somehow or other to give you the 2 boys' names.
For sure.
And I'll give you a call back.
Yeah, maybe if they win, maybe we can get them on the air, Donna. That would be cool.
It would be wonderful, and I think it's so good for the kids. There was 32 teams,
right?
And these kids won first place. Their parents, I don't know the boys, I don't know who they are. All I know is the teacher. But these kids, and the teacher has told me, these kids are good students. They're energetic and whatnot. And they had to do one project to do with energy efficiency. And then they won, like I said, but then they've got to do another one, a different one, when they go back to Newfoundland. So it was about 3 weeks ago, but there was nothing in the news, nothing in the paper. And I think when kids do good, they should get a little bit of PR or whatever the word is. But anyway, that's it. But the parents must be so proud of their boys.
Absolutely.
And I just wish, like I said, I wish them all the best. Nice, safe trip, and what an experience for these kids.
You're not kidding.
And they were judged, like I said, by a panel of experts, not just, somebody off the street. So I want to wish all the best to them, and hopefully next week I can call you back and say, guess what? These kids won.
Well, I'm looking forward to that call, Don. I appreciate your time. Thank you.
Okay, and thank you for taking my call.
Oh, for sure.
Have a good day. Bye.
902-405-6000, 1-877-801-8255. I agree, right? We talk about kids a lot, and normally it's when they're doing something nefarious or bad, right? When they do something good, what's wrong with giving them a little shout-out, right? We're going to take a break. Open Hour continues on the other side. You're listening to The Todd Veinotte Show. I'm Dan Alstrand. Back in minutes.
Axe.
All right, welcome back. Open Hour underway. Lines open. 902-405-6000, 1-877-801-8255. I was just watching some of the coverage of Dick Cheney's funeral in the newsroom, and was looking at some of the people that were in the crowd and got a little distracted. Anyway, 902-405-6000, 1-877-801-8255. Let's go back to the phones and welcome Chris to the show. Chris, how are you?
I'm good, Dan. How are you?
I'm well. What's on your mind today?
Good.
I bet you I can guess.
Okay, guess. I got $20. I'll give you if you can guess it. We'll bet.
The budget.
Damn! I just lost $20. Am I? Now wait a minute. You're cheating a little bit because Vanessa asked me what I wanted to talk about.
It's not a good bet unless you stack the deck, right?
That's the only way I can win a bet is to stack the deck. Look, I listened to, oh my God, there's so much to go through here, and I'm not going to take a lot of time because there's a lot of people want to call in. But I listened to the councillors on Monday, and some of their responses to things were ridiculous, in my opinion. Like, for example, rain barrels. They talked about rain barrels. I mean, is that as deep as they can dig into the solutions to our problems as rain barrels? I mean, come on, give me a break. As far as you asked the question about the golden goose, if there were any golden geese on their list, and they said they're willing to look at anything that staff is willing to recommend. I mean, they put everything, all of their faith is put in staff to do things. Too much is put on staff, and staff is making decisions, in my opinion, that they're, and this is just an assumption on my part, that a lot of them would not be qualified to make. They certainly were not elected. They have a vested interest in the whole thing, and I'll get to that point here in a second, because you looked at the forecasted budget for the next few years at the 12%, right? But did you also look in the column next to it of the forecasted compensations and benefits?
It's almost
increases?
half, right? Like the compensations and contracts is half of the budget.
No, look. The increases, Dan.
Yes.
The increases, 27-28, 7.6% projected increase in compensations and benefits.
Yep.
28-29, 8.75%. 29-30, 8.33%. Who the hell do you know that's getting 7, 8, 9% annual increases in compensation and benefits? I certainly am not.
I wish it was me.
Yeah, me too. Well, look who's recommending and forecasting these increases. That nice 5-letter word, staff. The recipients of these compensation and benefit increases are staff to a great degree. So, of course, they're going to recommend 8.75%. Also, your councillors talking the other day about how instructions were given to staff to come back with a bare bones budget, and they said, and I quote one of the staff members, a lot of the reductions are already baked into the 10.5%. Well, that's kind of a cop-out, in my opinion. How do we know that? Give us a list of what they were cutting and reducing to come down to 10.5%. And if that's true, what the heck was on the budget to start out with that would have put it so much more than 10.5? Because they're trying to make us think that 10.5 has already been pared down. The meat's already been shaved off the bone on this. That is ridiculous. It's totally ridiculous. But I was encouraged to see or to hear on your show how the mayor is pushing to have some cuts made here and there and so on. And as far as I'm concerned, the climate tax of 3%, that should be cut completely or postponed for a while or something, because that would be 3% of your 10.5 right there. Also, staff and council are looking too much to the property tax portion of revenues to cover the full extent of the $89 million. Property tax revenues are approximately 2/3 of the money that HRM brings in to operate our city or our municipality. 10.5% of the 850-odd million, that's about $89 million. Why look at that section? Why? It's low-hanging fruit. That's why I get that. But that's where they're looking. What about the other 1/3 of revenues? Where and why are they not looking there to increase them as well? They're looking to try and make up this $89 million entirely from what I consider the low-hanging fruit, easy to get at, property tax revenue increases. And I think that they should be looking further than that, because there's another 1/3 of revenues that, in my opinion, they're not even looking at. One more quick comment.
Sure.
Yesterday you had a caller from the rural area that was complaining about the taxes they pay going to benefit the city only. Guys, that's not true. the city of Halifax, the old city of Halifax, being North End, South End, Peninsula, and so on, that's the cash cow of HRM for property taxes. Everybody knows that. We had a councillor a few years ago that looked into the cost of goods and services provided to District 7, where I live, for example, District 7, and found that in District 7 at that point in time, we were paying double the amount of property tax dollars that we were receiving back in services and so on from the city. So let's look at that. Who's subsidizing who here? Thanks very much, Dan. I appreciate the time.
Have a good one, Chris. 902-405-6000, 1-877-801-8255. One of the one-third, I do believe, that Chris was talking about was and is service fees. And I know on Tuesday, when council met, they passed a new framework for that, and to bring those fees into line, I think was the way that they described it. Now, Chris is right. It's a form of revenue generation, but when you start to increase the fees for services that Nova Scotians that HRM residents use all the time, it's as difficult as a tax increase. I understand where Chris is coming from. I do, and I totally sympathize with y'all that are paying these property taxes and are looking at a $275 increase or more. In fact, it's likely going to be more for most of you because of your property value. But you have to. Chris is right. Everything has to be put onto the table. Everything needs to be looked at. And it was encouraging to me, just little Dan, to hear the mayor kind of trumpeting some of the things that we've been saying here on this program for weeks now, and that there should be no golden gooses. Everything should be on the table to take a look at to get our financial house in order. There was a presentation before council a few weeks ago when they were talking about their fall debenture, when they approved the purchase of a debenture of $450 million for the fall. There's a chart on there, and Councillor Purdy from Cole Harbour yesterday referred to it. And the amount of debt that this municipality is going to undertake in the next 5 to 6 to 7 years, if you look at that chart, it's almost a hockey stick. Like, we're talking $1.3 billion in debentures. That's how the city government borrows money, if you're wondering what a debenture is. And just think about the debt servicing on that, right? That's before we fill a pothole. 902-405-6000, 1-877-801-8255. Open hour continues after the news.
Axe.
Welcome back. The open hour continues. Lines are open, 902-405-6000, 1-877-801-8255. An opportunity to chat about whatever it is on your mind. There's been discussion, of course, on the municipal budget, but discussion not limited to that subject only. If you want to talk about something else, here's a golden opportunity to do just that. 902-405-6000 or 1-877-801-8255. Back to the phones. Welcome, Jim, to the show. Jim, how are you?
Good morning, Dan. How you doing?
I am well, Mr. Hoskins. What's happening?
Oh, I'm going to try to shake things up a bit. I've been watching the council budget sessions, particularly last night, and it's been quite evident to me. As you know, I ran for mayor last year.
You did.
I had a platform. Andy Fillmore had a platform that he just can't get put forward. And what I'm saying is I'm watching a circus is what I watch every time. I've been around this city for a long time, and I've watched many councils, and I know there are councillors that are retired that are probably listening that would push back on what I'm about to say, but I'm going to say it anyway. As long as this council has to work under the previous role, I guess you would say, of a mayor versus council, we're never going to move ahead. Now, when somebody runs for mayor, they have a vision. Well, a vision's not good enough. Anybody can have a vision. But what we need is leadership. And what I mean by leadership is that the mayor can come into that council with 16 other people and say, here is what the general public wants me to do, at least in accordance with the mandate that I put to them that I would do. And then the mayor could bring his own budget in and then try to convince those councillors to go with that budget. But the mayor would have the authority to say, no, that project like the Forum is not going forward because that was in my platform. We don't have the money to do it, and you can have your debate. But if 2/3 want to overrule it, fine. But the basic issue here, what I'm trying to express, is that we need leadership. And the mayor in this system of government that we have now is being restricted. And that's what I would argue as to why we're going. You said that the acting city manager can forecast 4 years away. You can't do that in this economy. And to say that the tax rate's going to be X number of dollars down 4 years from now is almost, I won't use the word ridiculous, but it's certainly premature. We need leadership. And Andy Fillmore's hands are being tied. He was overruled a couple times there. A lot of the councillors there there are some councillors there, in my opinion, I would argue, have their own agenda for their own constituencies because that's where they're comfortable. But when they can sit there and not even know, a lot of them didn't even know last night, I think it was, how the reserves work, the reserve money that's put aside and why it's there for emergencies and everything else, among other things. So that's what I see, and I think the mayor needs more power to get things done. Now, I see Tim Houston, the premier, is on your show tomorrow.
He is.
If I get a chance, I'll call in and ask him why he's not increasing the powers of the mayor like he said he would.
I don't put words in your mouth, Jim, but it sounds like you're advocating that Tim Houston hand strong mayor powers to Andy Fillmore.
Yes, more, because you're not going to get anything done. It's going to be the same thing. I've been living in the city. I'm 76 years old. I've been living in the city and watching this council. I've run for council. I've run for provincial parties. And I can tell you that nothing is getting done because the 16 other councillors have their own agenda. Some have even, they're politicized it with political parties. It's quite obvious what's going on. They spent hours, almost hours, arguing about something foolish like maybe a little ballpark or the reserve funds, for example. And a lot of them didn't even know the processes or how those funds became available. It was like they've been sitting in the dark for the last year. We need leadership, not visionary.
Jim, appreciate it, sir.
Take care.
902-405-6000, 1-877-801-8255. Not entirely sure on how the strong mayor powers work on a budget. I'll have to do some homework on that if that would allow, if granted, would allow a mayor to impose his or her will on the budgeting process. I'm not sure how that works. Maybe somebody out there who is smarter than me, and that's pretty easy to do, can answer that question for me, because I'm not really sure how it works. Not sure if when it comes to the money end of things, if that is something that strong mayor powers would change, because it certainly would, at least in my opinion, create an imbalance, a larger imbalance than we see now if the mayor was maybe focusing on more urban stuff rather than the rural stuff. And we know that we get that talk about that a lot, right? Couple emails to pass along. This one comes to us from Rob. Says, Chris is exactly right. Staff shouldn't be in a position of making recommendations which turn into decisions. It's the responsibility of councillors to make those difficult decisions. They should simply instruct staff to come back with a series of cuts that would result in a 0% tax increase. They should encourage that, that should encourage and challenge staff on their assumptions. I'll agree with half of that statement, Rob. I think you're right. I think that if you say, okay, staff, we want a flat tax rate, give me that option. Give me a 2% increase option. Give me a 5% increase option. I think if you give them a goal to work towards, it came up a couple of times last night, and it was the CEO again, Mr. Anguish, Brad Anguish, saying that if you give us the right direction, then we'll go to work. I think he said roll up our sleeves. So that would have been the way that I would assume we were going to go about this, rather than just say, go, no, you didn't do a good enough job, go back and come back again. Staff making recommendations, I don't think that's exclusive to just to municipal governments, right? I mean, the city is a corporation. It's run by a board, right? The board of city council. And even in a big corporation, staff members or people that work under the people that sit around the big table will make recommendations. It's council that has to wade through those decisions and not just blindly follow suit. And I'm not suggesting they do, because, I mean, Dartmouth Cove is a prime example of that, right? Staff recommended that they not move forward with what they were doing, and they said no, and then they rescinded a rescission, and we got to where we were. But I don't think it happens all the time. I think it happens too often that staff recommendations are accepted, but I think you need to have the information before you to make an informed decision. Now, is Chris correct saying that having staff look at staff cuts as part of a budget, is that a conflict? I think you certainly can make an argument for that. 902-405-6000, 1-877-801-8255. Let's go to Al. Al, how are you?
Good, very good, thank you.
What's on your mind?
All right. The budget, okay, and this is, whether you cut me off or not, but this is probably, no one's talking about the immigration policy of the government of Canada, Nova Scotia, et cetera, okay? Here we have thousands of bus passes issued free of charge, okay? Cell phones, I'm well aware of that there is a substantial financial deposit made to immigrating families to their bank account. Actually, bank accounts are open for them. So we have to cut back on immigration. We don't have the resources to look after them as far as, housing, medical, other services, That's a big problem. And the other problem is these instructors that are teaching new people that are arriving how to drive don't know how to teach people how to drive. I mean, you may have experienced it yourself that you were driving down the road.
But how does that impact the budget, Al? Like, I don't understand where you're going here.
All right, well, I'm saying the whole picture is the immigration status. You have to cut back on services, okay? You can't be giving them a free pass for everything. How many millions of dollars is it costing us to supply all these, people, all these facilities? That's all I got to say. I don't give I don't care about, I understand about the tax rate and all this other stuff, but there's where cutbacks can be made, but nobody's touched it. And nobody wants to speak about it because it's taboo or you're racist or whatever. And that's the problem, okay? We do pay too much to bring people into this province, and we don't have the resources to pay for it. So anyways, that's all I got to say. Have a good day.
Appreciate it, Al. Housing is a provincial responsibility. Medical is a provincial and a federal responsibility. So I don't know how changing that would impact the city budget, as you framed the question on the budget. The phones, I don't think that's a city program. I stand to be corrected, but I don't think it is. In fact, that's probably one of the first things that I've heard about that, and not saying it isn't true, but I don't think it's a city program. The bus pass thing is a city initiative. I 100% would agree with that. And so is the thousands of bus passes that the HRM hands out to students. So if we're going to hand them out to students, is that something we should look at cutting? I think the initiative behind that was to introduce kids to the use of transit so that they become transit users moving on, right? I've heard from people that if you get on a bus in HRM when school's in at lunchtime, it's a bit boisterous, I would just say. But the other things you raised, Al, not a city issue. Those are municipal or provincial and some of them federal issues. But I'm glad you called. 902-405-6000, 1-877-801-8255. We're back after the break. Welcome back. Open hour continues. 902-405-6000, 1-877-801-8255. An email from Colin says, here's an idea. Let's get rid of the capped assessment program and actually collect revenue on current values of properties instead of artificially deflated value. We're trying to run a city today on values from 10, 15, and 20 years ago. 902-405-6000, 1-877-801-8255. Let us welcome, let's go to Jeff. Jeff, how are you?
Hey, how you doing, man?
Good. What's on your mind?
Oh, not a lot. Just what last caller there saying about the immigration, and some of them get checks into their account and stuff. Sure, some of them do. I have no idea. Maybe they do, maybe they don't. But the ones I work with, the going joke I have with them is I ask them every other day if they got their check this month, and they don't have a clue what I'm talking about.
Right.
So, I don't know, right? And if it's what it is, and you're right, it's probably more of a federal program he would be talking about. Maybe, I have no idea. We just, it's a hard thing to look into, right? Because it's such a touchy subject.
It is, but I've been trying to sort of qualify some of the programs that I'm hearing about on the show. The employment supplements and those kind of things, and I have yet to been able to find the right information.
It's a hard thing to procure,
right?
Yes,
So
it's a hard thing to.
If somebody has the forms out there for that program, can you send them to me so we can take a look at them? Hey, Jeff, I appreciate it.
Yeah, shoot him to Todd Veinotte Show. Thanks, Dan.
All right, Matt. 902-405-6000 or 1-877-801-8255. I'm not being facetious. I'm genuinely curious. If this program exists, Can you guide me towards it? Because then we'll bring it to everybody's attention, and maybe there are some business owners out there that would benefit from that, right? So let me know. Shoot us an email or give Vanessa a call or join the show. We'll love to have a conversation. 902-405-6000, 1-877-801-8255. Let's welcome Kathy to the show. Kathy, how are you?
Hi. How are you this morning?
I am wonderful. How are you?
Good. One of the things there's a couple of things that I wanted to say.
Sure.
First of all, my first thing that I want to say is that when you run out of things that you can cut at the bottom of the food chain, then you got to look at the top of the food chain.
Right.
And I really feel that there are too many council members. I mean, they can't make a decision, so maybe we need less of them. And certainly we would make some savings there. And are they doing their job? Let's have a look at that. Are they really doing their job? Because they don't seem to be able to make decisions about bike lanes or anything else. The other thing that I wanted to mention was the fact that when the city goes out there and decides to do work on roadways and things like that, the left hand doesn't seem to know what the right hand is doing. I've seen time and again where we will go through somewhere and they'll be doing one thing and they'll fix it, and then you'll come back 3 weeks later, they're digging up the same area, doing something else again because they forgot to do something, and then doing it again. I think that they need to come up with some more streamlined processes that cut out the duplication and allow for one department to talk to the other to basically quit this over duplication of things, and because we're just paying out money for nothing.
It's been a frustration of mine, Kathy, for a long time that they'll tear up a street and to put a service in and then pave it again, and then 6 months later tear it up again, put another service in.
Exactly. And if they were talking between, like, maybe they got to look at what the federal government is talking about, having one central point where all of these things come into, where they can make all that decision process in advance. And I know that does take a little bit of time, but perhaps it would save us some money.
I think it would save us a lot of money. Kathy, I appreciate the call.
All right, then. Bye-bye.
902-405-6000, 1-877-801-8255. We're almost in 2026. There has to be some kind of technology out there where we could put all the city projects together that are happening for the year, and I'll even extend that and say all the provincial projects that are happening for the year into some kind of database, and then I don't know if it's a human or if it's AI or whatever, can figure that out so that it makes sense and it's we're not duplicating, as Kathy said. I think that probably should. If it doesn't exist, I've just given some kind of coder or programmer $1 million idea. Last word today goes to Nicole. Nicole, how are you?
I'm well, Dan. How are you?
I haven't heard from you for a while.
I know. I was too frustrated, I think, to get into the minutia of what's happening. But Mr. Hoskins called in, and he was, kind of lobbying for the mayoral superpowers. And I don't know that actually really solves anything. I don't know if giving a single person more power to move something along solves a bigger issue. And I think the bigger issue that we have, and I think the frustration that we hear coming out a lot, is a lot of people feel like this particular council is incompetent. And perhaps instead of using the word incompetent, I'd like to invite people to maybe think of the word illiterate instead. Because we have an entire council that is showing us repeatedly that they are structurally illiterate. They actually don't know how everything functions. And they're waiting on the opinion of too many people who have their own interests to advise them on how to move forward. And if we think about this practically, if you want to be a lawyer, just to get to law school, you have to write the LSAT. You have to show that you have enough fluency and proficiency and literacy in this given area to even go to school to learn how to maybe write the bar to become a lawyer. We have the same thing with doctors in the MCATs, the same thing with MBAs who have to write the GMAT just to get into an education program. And we have all of these politicians here running feral because they can get enough money and sway enough votes to be put into a position of trust that they haven't actually showed they have the proficiency to hold. And when I think of the last elections, I've never met Becky Kent. She's never knocked at my door. I don't know where her votes came from, but probably not my building. She wasn't here. In 2021, when I moved back to Nova Scotia, Braden Clark knocked at my door when he was running for MLA, and I had questions for him about the Emergency Management Act. Pretty important document at that time. It was only 16 pages. And he looked at me and said, I don't know, I've never read it. And all I could think of was the audacity to knock on my door and ask for my vote, to sit in a legislature that is in charge of this document that's held everyone hostage for almost 2 years, and you haven't even read it? And you're willing to say that out loud? So when I take a 50,000-foot view on what's happening in local politics, federal politics, provincial politics, I think we have to remember that there's no standard to becoming a politician. There's no proficiency test. And I don't know if that's the first thing that we look at potentially implementing. You need to be able to sit down and pass a test to even be eligible to take on this position of trust. I don't know that any of them would pass it right now, but I don't know if that's an answer. I don't know if it's a solution. I don't think the politicians are going to require themselves to do it, so I don't know that it's ever going to be voted in. But I think it could serve us really well to start looking at our council as being illiterate and looking at a lot of our politicians as being illiterate. They have signed up for a job that they've never really been trained on, didn't have to pass a test to get, and actually don't know how to do it. And because everything internally is so siloed, they really have no choice but to rely on advice and opinions from so-called experts. But even a simple test to show that they can exercise discernment and use proper reasoning skills, which is pretty much the LSAT, that would be really helpful, I think, going forward. But until that day happens, I'm always working off of the assumption that the elected official I'm speaking with is illiterate in their particular job.
Nicole, thanks for the call. Appreciate it.
Thanks, Dan.
And that's going to do it for the open hour. We're going to do it again tomorrow, the Friday free-for-all from 11 until 12. I'd love to hear from you. And just as an aside, when Nicole said mayoral superpowers, is it wrong that when she said that, my mind went to a mental picture of Andy Fillmore in a superhero suit? Think about that one during the news. We're back in minutes.
Facts.
Welcome back to the Thursday edition of the Todd Veinotte Show. I'm Dan Ahlstrand. Glad you're able to spend a few minutes with us as we roll through your Thursday. And the finish line's just around the corner, isn't it? Tomorrow is Friday. I'm going to roll back the clock a little bit here and go back to Tuesday night's council meeting where municipal councillors took a presentation and had a discussion and debate on changing the framework on homelessness, their approach to homelessness in HRM, and the presentation was one that I found rather interesting, and we're very pleased to welcome into the show today the acting director of housing and homelessness for Halifax. That's Ashton Stephenson. Ashton, welcome to the show.
Thank you so much, Dan. Thank you. Happy to be here.
I guess the first question is, from what I recall from the meeting on Tuesday night and the presentation that you made to council, that currently there are 3 designated encampment sites in HRM. One of them, Lower Flynn, is in the process of being closed. And when that's done, there are 2 more, and you've laid out an 18 to 24 month plan to have those 2 remaining sites closed. Is that correct?
That is correct. That is correct.
So the first question that came to my mind when I saw that, if there's 2 sites, then why such a long period of time? 2 years is quite a long period of time.
For sure. Thanks for the question, Dan. Honestly, it's because we want to take a careful approach and a person-centered approach because, sometimes this stuff takes a lot of coordination, coordination of moving belongings, coordination of finding the right, suitable, appropriate indoor option for each individual. So we want to be gracious with the time. We know that once you announce a closure that, it comes with heavy feelings. A lot of people are going to feel like they're being displaced. So we want to give enough time to be able to work with each and every person individually to find them the right option.
Ashton, in that same presentation, it was revealed that I think it was the numbers were calculated at the beginning of November, and that there are currently 45 people living in those 3 designated encampments. Is that accurate?
That is accurate. As of last week, that is accurate. I'm going to get updated numbers sometime today or tomorrow.
Right.
But as of last week, that was the number in designated encampments.
And that there were, I think the number was 67 spaces available in provincial shelters, right?
So that was spread out between shelters and supportive housing environments. And yeah, I'm getting a lot of questions around, if there's 67 indoor spaces and there's 45 people outside, why aren't they in there tomorrow? And I've always said it's not that linear. We have to make sure that the spaces are right. And some of them are and some of them aren't. So right now our job is to make sure we're connecting with each individual to find the appropriate indoor space out of those 67 options. And also those numbers do tend to fluctuate. So we are getting updated numbers for this week coming soon. Yeah.
So when you look at those shelter spaces, Ashton, to see if they're right, is it a combination of both right for the individual who's living rough and for the shelter, or is it more focused on the individual who's currently living in one of the encampments?
Great question. I would say both. Indoor spaces all have criteria and requirements, and individuals have preferences. So we have to do a match. So, most people want privacy. Most people want a space to secure their belongings. Most people want a safe space. Most people want, access to heat, warm water, shower, bathroom, etc. Not every indoor option provides that. So we got to be very careful about how we're matching and who we're matching folks with. And also, to your question, Dan, service providers. Service providers have a specific criteria for which people they want to come indoors. It's not just any and everybody. So there's a lot of matching and coordinating that has to be done.
And that brings me to a call I took yesterday from an individual who said he was currently living in Lower Flynn Park, which we know is in the process of being closed. And he said that outreach workers met with him yesterday, which is fantastic. and said that they told him that they didn't have a space available for him yet. And of course, when I heard that, and the numbers that we just talked about with 67 spaces or whatever the number is now open, that kind of raised an eyebrow to me. But it's a case by case basis, right?
Case by case. So I don't know who that individual is. I know we're going to have outreach out there this week, probably already there as we speak, to, once again, case by case coordinate who and where individuals need and want to go. So I can't speak to that individual because I don't know who it is, but we're definitely going to be connecting with everybody on site.
Ashton, he did say in his conversation that him and several people that are living currently at Lower Flynn, which, as we've said a couple times now, is going to be shuttered probably by the middle of or beginning of December, that the stress level goes up and that they're starting to get stressed out. Is that common when we go through these processes of closing these sites?
Well, yeah, it's definitely common because, people are in survival mode. People are sleeping outside. Like, when you really think about that, I know we all start our cars in the morning and get it heat up to drive into work or take transportation or whatever your means are to get to your, taking out the garbage or whatever the case is. The mornings are cold, the nights are cold. Sleeping outside is not easy. So there's already stress there. Now, once people are rooted and grounded in sleeping outside, when we give some kind of notice as to, the park's going to close, of course, stress goes up because it's like, where am I going to go? Now, we try to mitigate that stress by connecting with each and every individual and by reminding them, like, we're going to do everything in our power to get you into an indoor space that's suitable for you. That is the day in and day out goal for outreach, for, housing support workers. We're trying to connect the right spaces for each individual. So any type of notice is going to induce some kind of, fear or anxiousness because of the unpredictability of, where people are going to go next. Natural feeling, we're just trying to do our best to mitigate those feelings.
Ashton, with winter approaching, some will suggest it's already here. Does that mean that you'll see an increased demand for indoor spaces as those nights get colder and the frost and snow descends on us?
Based on numbers, every year, winter, fall into winter, we see less people sleeping outside. So I do suspect that people will gravitate towards indoor spaces. Now, in all honesty, that's strictly from a survival perspective and not necessarily always from an appropriate perspective. People need to be warm to survive. So yes, to answer your question, yes, most people will go indoors because it's getting colder.
Ashton, we're talking about this 45 number, obviously in flux of people that are in the current established designated sites, but we know that there are others that are living outside of those designated sites. Do we have any indication how many there are, and if outreach is getting into those communities and groups too?
Yep, there are non-designated locations. I don't have concrete numbers, but I know that our outreach team still connects with people in various locations, wooded areas as well. We get calls through 311. We get calls from residents, emails about, this person is residing here, and we send a team to go and connect and try to find them indoor options and other available supports. So yeah, I just don't have numbers for you, Dan, but there are people that are living in non-designated areas as well.
Ashton, we mentioned that the plan is to have those two remaining sites once Lower Flynn's closed down within the next 24 months. But we know that there are always going to be people that are living rough. What's the plan after that? If are we going to see how the situation unfolds and maybe designate spots again, or what's the long-term plan for homelessness here?
We have to work in collaboration with the province to all of our efforts should be towards indoor spaces. Indoor spaces. That's what we have to collaborate, and all of our efforts need to be towards that agenda, and appropriate indoor spaces, enough space for people to use the bathroom, have privacy, store belongings, and feel safe. That's the key. So that's where all of our efforts are going to be pushing towards is working with the province collaboratively to find indoor spaces for people.
Ashton, I know you're busy, and I appreciate your time today.
Thank you so much, Dan. You take good care.
That is Ashton Stephenson, the Acting Director of Housing and Homelessness for Halifax. 45 people currently living in designated sites, 67 spaces at last count available, obviously in flux, and 2 years we will work towards to see those the two remaining designated sites closed down here in HRM. When we come back, a return engagement for our next guest. It's a tick repellent. We talked about this months back. It's winning awards. And we're going to dig into it and how it works and how effective it is with Nicoletta Faraone is the Associate Professor of Chemistry in the Chemistry Department at Acadia University and is now an Innovation Award winner for her tick repellent. I don't like ticks. I know you don't like ticks. We'll find out how to get rid of them after the break. As we roll on here on a Thursday afternoon, glad you can spend some time with us as we watch the week work its way to the Friday. And I know I keep talking about it, but I want everybody to make sure that they know that we are going to welcome the Premier of Nova Scotia onto this program at 11 o'clock tomorrow morning for a full hour. So we're going to ask him some questions. He's going to take some calls, and we're looking forward to it, to say the least. I don't think it's any secret that I spend a fair amount of time, in the wilderness of Nova Scotia. I like to be into the woods and getting out there and enjoying some of the beautiful things that we have to offer here in the province. We're so lucky to be, particularly here in HRM, well, just about anywhere in Nova Scotia, that we're minutes away, for the most part, by car into wilderness, into pine forest and those kind of things. And of course, as of late, in addition to spending some time in the woods, I spent some time after the woods, looking to see if one of those infernal ticks managed to find its way onto mine. For whatever reason, I'm a magnet. They just love me. And there's been some research done on this, of course, because there are some serious health concerns that come with tick-borne diseases, right? And we've talked about it on house calls, and many of you have had an experience with a tick bite in the past. Well, Acadia University researcher has been recognized now with a national award for outstanding innovation for her work developing Canada's first all-natural, long-lasting fabric, easy for me to say, spray tick repellent. And that researcher is Dr. Nicoletta Faraone, and she joins me. Doctor, how are you?
Hi, I'm good. How are you?
Thank you. I think for many of us that spend time in the woods, thank you for creating this repellent.
You're welcome.
Tell me a little bit about the genesis of this whole thing. Obviously, you started to develop this. It just didn't happen overnight.
Oh, no. This is a long-lasting project that started many, many years ago. Working together with Atlantic Repellent Product and the CEO and founder, Lisa Ali. So we wanted to create a product that would make a difference, and it would be a great alternative for people that like the outdoors. And it's something that you don't apply just on your skin, but you can use on fabric, so on your clothing and on your camping gears. And it's a product that we wanted to make it completely natural. So it's based on essential oils. It's the same active ingredient that Atlantic Repellent product uses for their botanical spray. But we wanted to make a new formulation that will stick longer on fabric. And it's something that it's totally, let's say, new because, so first of all, in Canada, fabric spray that they have as an active ingredient an insect repellent. They're not available. You can buy it in the U.S. They are permethrin based, and permethrin is an insecticide, so basically kills by contact. And Health Canada doesn't allow those type of products in Canada. They are not registered yet. So we wanted to create a product that is new, that is safe, and is environmentally also compatible, and it will be based on a natural product and a food grade ingredient.
How does it work? If it's not an insecticide and it doesn't kill the tick, how does it keep it from attaching itself to my clothes and then eventually to my body?
Well, it repels the tick. So we don't know yet the mechanism, so the mode of action of the active ingredient. It's something actually that my research group is studying. So we're trying to describe this at molecular level. But what we know is that the ticks are repelled. So they cannot get in touch, they back off. And if they get in touch with the fabric that is treated, they will just drop off. So
wow, so it's just they just don't like it, so they leave it.
Yes, they don't like it. And with our tests done in the lab and in field condition, and we did also human trials with very brave volunteers that were in the lab with us for testing the product. It lasts up to 7 days from the first application. So it's great for, especially for a trip in the woods, and you can be protected for lots of hours.
Is it? Does it smell? Does it stink?
Oh no! It smells nice. It's essential oil based, so right. It doesn't smell chemicals. It's very fresh, lemony type of scent, and it's very pleasant.
Because most of the repellents that I use for other things like mosquitoes and black flies is pretty awful smelling stuff.
Yes, it can be. Yes.
So is this repellent now available on the market? Can somebody go out like me and go and buy it?
Not yet. So the company Atlantic is going through the product registration through Health Canada and PMRA, the Pest Management Regulatory Agency, and we are basically on the final stage. So hopefully it would be available on the market by next summer.
Well, let's hope, because ticks and I don't get along.
I bet. Yes.
Not to mention all the health concerns that are associated with tick-borne disease.
Of course. So the idea with this product is try to reduce altogether the contact that humans can have with ticks and a potential tick bite, because we know very well that ticks are the primary vectors of very nasty pathogens, especially those that cause Lyme disease. So if we can reduce and avoid the contact and potential exposure to tick bite, we can reduce also the transmission of these diseases, and also hopefully to reduce the pressure on the public health. So prevention is really important.
You mentioned this is designed to be sprayed on clothing. Is it safe for your skin or maybe your pets?
It is, because it's all based on food-grade natural ingredient. The formulation is meant to be applied on clothing because it's able to bind and stick with the type of fabric. That's why we have a long-lasting persistency. But if it gets into your skin, it's going to be okay.
Well, we're looking forward to, at least I'm looking forward to seeing this stuff hit the market so that I can get out there and put it to the test. Dr. Faraone, I appreciate your time.
Thank you so much.
That is Dr. Nicoletta Faraone from the Acadia University Chemistry Department, also the lead at the Canadian Tick Research and Innovation Center at Acadia. They're getting into the ticks because they're not going away, folks. I've had more ticks than the last couple of weeks, months, than I have all year. So it's a year-round problem now, and I've heard stories that will, well, it's getting around lunchtime, I won't tell you, but there are, particularly I'm finding with people's pets, that they're seeing an uptick, and in not in the wilds of Nova Scotia, in places close to home here, like Lunenburg County, where the tick population, for whatever reason, is quite strong. I'll be very happy if I can spray something on my clothes and be protected from ticks. It'll make venturing into the woods that much more fun. We're going to stop and take another break here on the program, get an update on what's happening in the news on the other side of the newscast, and change things up a little bit. There's a local artist, singer, songwriter that's come out with a new picture book that's based on the song It Snowed. Meaghan Smith will be in studio when we come back. You're listening to The Todd Veinotte Show. I'm Dan Alstrand. We're back in minutes.
Axe.
When you write a song and then a book called It Snow, this is the old saying. This is going to be very much a pun, but it's the most wonderful time of the year because we are into that season where Christmas is right around the corner. The temperature is starting to drop, and as I mentioned off the top of the show today, many of you are perhaps going to use this fair weather that we're having for the next couple of days to get out there and get your house all Christmased up. And when we Christmas up the house around my place, it's tradition that in addition to the eggnog, that we put some Christmas tunes on and start to replace our vast collection of periodicals on the kitchen table or the living room table with Christmas themed and winter themed books, and that's why this is an appropriate interview. You've probably seen Meaghan around because she's just about everywhere these days, it seems. In the studio with me today is singer, songwriter, painter, author. Did I miss anything?
Mom.
Yeah. And that's Meaghan Smith. Meaghan,
Hi.
how are you?
Hello, everybody. I'm great. How are you?
Well, it's good. It's good to be in here. And
I'm so happy to be here.
Your toque on and your sweater on.
And
you got
sparkles. I'm wearing sparkles.
Sparkles?
Yeah, because I'm here to talk about some sparkly business.
Right. It's a sparkly time of the year.
It is.
So, Meaghan, the song, right? This was the genesis of this.
My song, It Snowed, yes. I wrote it quite a while ago, actually, for a project I was working on with a couple of friends. We raised money for Feed Nova Scotia, and they wanted me to write an original song. So I came up with this idea of a snow day because, we all have different traditions and beliefs in this time of year, but everybody has to deal with the snow. Some of us love it.
Everybody loves a snow day.
Some of it, everybody. I feel like we all do. Don't you? Like when stuff gets canceled and suddenly this whole day is ahead of you and there's like nothing in it yet. So that's what my song It Snowed is about. And it has grown in popularity and sort of like really taken on a life of its own over the past, 10 years since I wrote it.
It's amazing how these things just get out there, right? And then they just go, they find a life of their own and
it's incredible.
And viral gets used too much, but they just end up in places you never thought it would end up.
It's true. And I was telling you before we went on air, every year on the first snow, I get a flurry of messages from people. Oh my God, it snowed. Your song is in my head. So I guess, that was the impetus of me thinking maybe it could be a great picture book.
And then you decided that, okay, then we're going to create a picture book, which most people will tell me are harder to do sometimes than writing songs or writing books.
Well, I will say it took me a long time because I also illustrated it. So that actually took months and months to do. But I released the book with Nimbus. It just came out. And the pages, I colored myself in colored pencil, and they're all like dreamy. And there's like these two kids that go outside and play. They realize it's a snow day. They go outside and play with their dog, and they have a really grumpy cat who hates the snow. So I wanted to include something in there, a character that really hates the snow, because not everybody loves it. That's fair. But they go outside, they play, they meet some chickadee friends, and they come back in and get cozy and then wish for another snow day. Which most kids do. I mean, I as an adult also do. Interesting story about snow days. I've been working in radio for 30 years now, and it's my job to drive in on a snow day to tell people to stay home. So just once, just once, I want somebody to call me and say, Dan, you could stay home today. You can stay home today. Right? Oh, my gosh. So the book is out, and it would make a fantastic stocking stuffer. It really would, if you can get it. So get it if you see it. It's sold out on Amazon really quickly. I've been told that it's been restocked. It's available everywhere you can buy books, and it's just such a cozy little book for you and your people to read together. And yeah, you're, as I mentioned off the top, author is just one of the jobs on the business card these days. Independent author, independent artist, songwriter. Yep. Married a producer, which probably helps keep the creative juices going. It sure does. We work together. My husband, his name is Jason Mingo. He's an extraordinarily talented musician and writer himself. We work together we write songs for publishers, but we are also currently writing custom songs for people, which we've been doing for 9 years now, full time. What's a custom song? Is that I come to you and say, hey, Meaghan, write me a song about X? Yes. Yeah, that's it. I'll write you a song, Dan. There you go. You got a song in your heart. I'll write it for you. Maybe. Everybody does. Everybody does. And songs are songs, and they're great, but they're not super great unless they're performed live. True enough. The segue to that is that you're doing some live shows. I have 2 shows at the same place, so it's basically one show. At the Bella Rose Arts Center on December 19th and 20th, I will be performing the holiday show. This is going to be a holiday bonanza. I have a full band. We're going to be performing a lot of Christmas songs. We've got a children's choir joining us, and there's going to be an actual wizard who's going to come on stage and do some magic tricks. And I have heard that Santa is going to stop by too. He's real busy, but he's going to make some time for us. I've been trying to book him. How'd you do that? Oh, you gotta have the connections. They say that I'm on the wrong side of some list. That and I'm able to book him anyways. You can meet him if you come to my show. But Vanessa isn't, so Vanessa is going to work to try and get Santa to join the show as well. So that's on the 19th and the 20th of December. Right. That's right before Christmas. It's right before Christmas. Perfect timing for when you've got everything done and you just want to relax and chill out. My goal with this show is to make it as magical as possible for children, but also for grown-ups, because when you're a grown-up, the magic happens after you put a lot of work into something. Right. And I really want grown-ups too to just have a magical experience where they don't have to put in a lot of work. They can just show up and enjoy a fun, festive, very sparkly show. And everybody who comes, this is not a requirement to get in, but you are invited to wear something sparkly. Strongly encouraged to wear sparkles. Okay. Yeah. I don't look good in sparkles? I don't know. Anyway, Meaghan, your eyes are sparkly. Well, there you go. And at the end of the show, go figure. Meaghan, you mentioned all of the things that you're doing these days, and I'd like to ask. Provides comprehensive managed security services that your business needs with managed firewalls, dark web monitoring, and proactive. And now we found it. Anyway, Vanessa's working on it. I ask artists this question a lot that come into the studio about the grind, right? It's to be this is your full-time job. This is what you guys do for a living. Tell me a little bit about being an artist in Nova Scotia and trying to make a living at it. Well, thanks for asking. This is really something I'm really passionate about. We are 100% independent, meaning I don't accept government grants. I don't have a label backing me. We are doing everything ourselves. And by that, I mean we are fully fan supported. So there's a reason I live here. When I did have a major label, I was signed to Warner Records. And when I did, they were constantly asking me, please move to LA or Toronto or New York, somewhere where it's easier for us to access you. I never left. We always stayed here. Our home has always been here, and I'm never leaving. Sorry, I'm here to stay because I love the people here. And I also love this land, and I'm here to stay. So, we are supported by the people who love what we make and who love what we do. And we're just going to keep making and doing that for as long as we possibly can.
In today's world, where everything has changed, right? I'm a little bit old, so I remember the release to radio, and then the record launch, and all of that stuff. Now with the world being in the world of streaming, and is that easier to get your products out in front of ears as it was the old days?
I think there's just more,
right?
And a lot of stuff is great, so it's very competitive, but I find that if you can make something authentic, people know, people can tell. If you make something that really came from your core, like your soul. And with everything I make, that is what I'm aiming to do, is be my authentic self. In that I want to connect with other people who are also their authentic selves. That's all I'm doing as an artist all the time, is just trying to connect in an authentic way. So if you like what I make, it would be awesome to see you at a show, or, buy my book. I'll sign it for you. I just, in any way, let's connect.
The book is It Snowed. The song is It Snowed. The show is December 19th and 20th up there at the Bella Rose. That's the name. I would just call it the Bella because it's up the street from me. Yeah. The Bella Rose Center, and you can get into the Christmas spirit and support some local artists who we're very happy stayed home. Thanks, Meaghan.
Thanks so much.
I appreciate it.
Thank you.
That's Meaghan Smith, and that is the song is It Snowed. I hope it's not bad luck that we're talking about snow.
Oh, it's going to start snowing. Don't you worry.
Well, we'll blame you.
Okay.
We're going to take a break. The show continues. We're back in minutes.